guys, welcome back to Medical Coding with Blue. So today's episode is going to be a little different. I'm going to be talking about some additional certificates that are out there in the industry, like the Cehrs, the Cbcs, and the Nrccs. Now these sort of certificates have been coming up a lot in the comments, and people are asking about these because their school that they're going to for medical coding, medical billing and coding, is offering these. Do you need these particular certifications or certificates for a career in medical coding? All right, so if you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so not all certificates that are out there are worthy of your response, your purchase, or even having them on your name. There are 4 main medical coding certifications out there in the industry. There's the CCS, that is the gold standard of medical coding credentials, that is a certified coding specialist. The CCSP, the certified coding specialist physician base. The CCA, the certified coding associate. And then there's also with AAPC, these first 3 are with AHIMA, the American Health Information Management Association. The last one, CPC, is the flagship credential for AAPC. Now, I've done many videos on what these 4 main medical coding certifications cover. I will leave the link in the description box below. So with those 4, as long as you have one of these to start off with as a brand new medical coder, that is all you need. Now, these medical coding programs out there, medical billing and coding, they're going to offer additional credentials sometimes with their program and say, oh, well, when you graduate, you'll be able to sit for this certification like the Cehrs or the Cbcs or the Nrccs, and you'll be able to have that along with your name, along with whatever other credential you're going to be sitting for. The more credentials you have, the more you're going to make, and the more prestigious you're going to look, and that is just not true, guys. It's not. All you need is one certification. There is a thing in this industry where they take advantage sometimes of these people that don't know better, and they try to sell them every single certificate that they can because they want to make them look more prestigious. When in actuality, when you get in front of that employer and they give you an assessment test, if you can't pass that assessment test, it doesn't matter what credentials are on your name. All right? And that's why I say all you need to start with is one. But no, these ones that I'm going to be talking about today, these 3, the Cehrs, the Nrccs, and the Cbcs, you do not need to become a medical coder because these are not asked for in the industry. I have done my research. I look for jobs in different states so that I can make sure that the advice that I'm giving you is going to set you up for success. Okay, I'm not here to sell you anything when it comes to credentials. Okay, before somebody says, oh no, Blue, you have all of your services and blah, blah, blah. I'm not talking about that. I am talking about certifications, certificates, all of that stuff. That's what I'm talking about. I'm not here to sell that. I never have, and I probably never will be trying to sell you guys anything when it comes to certificates wise, okay? So this first one, the Cehrs, the Certified Electronic Health Record Specialist, and the CBCS, the Certified Billing and Coding Specialist, that is offered with the NHA, and I have to write this down because I can never remember. The NHA is a National Health Career Association. This has nothing to do with the American Health Information Management Association or the American Academy of Professional Coders. This is just another association that is out there, and it is tied to a lot of these programs, and a lot of these programs will offer these 2 certificates because they're not really credentials. Credentials are something that's going to give your name some weight. There's not a lot of weight with these 2, in my opinion, okay? And I should say this first. This is my opinion. This is not the opinion of any association. Nobody's paying me to do this. This is just what I have seen as a veteran medical coder, and I'm trying to spare some of you, the heartache of having to spend money to take the test. And even if the test is free, there's still going to be another cost because they're still maintaining continuing education units, which I know for the CBCS they have to have. I didn't look up for the Cehrs or for the Nrccs. I didn't look up for those, but I did look up the cost on the Nrccs, which I'll get to in a minute. But with those 2, I'm going to start off with the Cehrs and the Cbcs. the CEHRS, the Certified Electronic Health Record Specialist, everybody uses a different electronic health record in the health industry, right? There's many different types. There's Epic, there's what did I just blank? There's Cerner, right? So there's a ton of different electronic health records. And even with Epic, you will see with Epic, there's different versions depending on what facility that you're at, because there's different packages when it comes to Epic. And so not all Epic systems are going to be the same, and not all systems are going to be set up similar either. When you get the CEHRS, the Certified Electronic Health Record Specialist, this just says that you've gone through a program that shows you how the electronic health record works, but it doesn't necessarily mean that that skill is going to translate into, okay, you're skilled in knowing how to use the electronic health record. You could be plopped into a system like Cerner and not have any idea what to do. Now, when you get hired on, this is the one area that employers are willing to do training in, which is in the electronic health record specific for their facility. They are willing to do that training. What they are not willing to do for brand new medical coders is, or even billers sometimes, is the training on how to medical code. That is where they draw the line, because they say when you have passed a certification exam, you should be able to code. And again, the only thing that they're willing to train you on is their particular system. So do you need the CEHRS? No, you do not. And to me, in my opinion, it's not worth it to put all that brain power into taking a test that's really not going to prove very much benefit for you in the industry. And that's just my opinion, because when I look at these job listings, they're not asking specifically for that, okay, the CEHRS. And that's just my opinion on that one. Now, the CBCS, people get real sensitive when I start talking about the CBCS, but here I'm going to tell you this. There's a lot of people that say, you know what, Blue, you're right, because I can't get a job with the CBCS, and they said that I could find a job, and, you know, my school said that, and, you know, now I have this credential and I can't do anything with it. The CBCS is more of a memorization test. It is like a billing test, okay? So basically you're given a set of questions and then you're trying to remember. For a long time, the CBCS did not require medical coding manuals. It did not require this. So to me, when you have in the name CBCS, Certified Billing and Coding Specialist, and you did not have the person have books, manuals, and how to demonstrate using them as far as, like, you know, showing that they can look up a code, and you didn't have that required for the test for a long time, to me that just does not give very much credit to that particular certificate. So that's why I say now, and it was started about 2 years ago, maybe 2 falls back, that they started requiring books. I think they're trying to like level up that test. However, it's still not asked for in the industry, and it still doesn't give your name very much weight, because on the 4 main medical coding credential exams, the CCS, CCA, CCSP, or the CPC, all of them test you on reimbursement. All of them are going to test you on that kind of stuff, the coding, the reimbursement, you know, even using electronic health records. It's all going to be on those exams. So do you need the CBCS? Absolutely not. And even though that may be included with the program, it doesn't necessarily mean you have to say, okay, I'm going to go and do all of this. You can if you want to, certainly. But if you have to pay out of pocket for it, I definitely would not go for it, because at the end of the day, it's your money. It is your money. And there's a lot of people who write into the channel. They're very money focused, and they want to know how much money are they going to make. But if you can't get the coding part down, if you can't get all of those fundamentals down, you're not going to go very far. And you have to study really hard. These 4 main medical coding certifications are hard enough to pass, let alone to say, okay, well, I'm going to get all these other things and be a member of all these other associations. I don't know if the NHA requires you to be a member, but to me, I certainly would look at investing where it's going to make the most impact, which is with either the American Health Information Management Association or the American Academy of Professional Coders. I've done a video on the membership differences between the two. And to me, that would be where I would focus. And even today, as a veteran coder, I would not waste my time with other associations that are not going to further my education and my knowledge base. You know, that's just what I'm saying, guys. So don't get sensitive if you have this, if you got it, if they sold it to you, you didn't know. Okay, guys, if you didn't know, you didn't know. You don't know what you don't know. But it's just about doing your research. But if you had done your research, you would have seen that in the industry, they're not asking for the Cehrs or the CBCS. And even if they do, it's going to be very few and far in between. It's like a needle in a haystack, because you're going to see that more of those positions are looking for the 4 main medical coding certifications: CCS, CCA, CCSP, or the CPC. Okay? So like I said, concentrate there, because that's going to be enough money in order to keep you busy, as far as like, okay, we got to pay for the test, maintain with the CEUs, and all of those things. So that's just where I would give you my strongest bit of advice. Now for this last one, which has a very sneaky name, the Nrccs. Now this is offered from the National Association for Health Professionals, right? I hope I got that right. The NAHP, okay? So there's a lot of places that can call themselves, we're the National Association of this and this. And so it's really all depending upon what are they about and what do they offer, right? So they offer the nationally registered certified coding specialist test. And they only charge $75 for this test. But you will see if you look up jobs for this particular certificate, right? You will see no one is asking for this. No one is asking for this for a reason. This test, and I'm telling you guys the outline of this test. There are 200 questions on this test, and it's you have to get 180 are scored. So I don't know what their pass test is, their passing rate is. I don't know what it is. But this test covers anatomy, abbreviations and terminology, anatomy and physiology, coding, but listen to what they cover in the coding. Common coding terms, characteristics of ICD-10-CM and CPT codes, use of ICD-10-CM and CPT codes, and HCPCS codes. What is missing from there? ICD-10 PCS. So they're only testing you on outpatient coding on this test. Outpatient, that's it. And they're calling themselves a nationally registered, this credential, nationally registered certified coding specialist. Okay. And then there's the next section is coding codes, practical ICD-10-CM codes, CPT general codes and modifiers, insurance plans, law and ethics, and office procedures and equipment, telephone techniques on a nationally registered certified coding specialist test. Telephone techniques. Okay. This is why I'm telling you guys, you have to be careful about what you're putting your money into and what you are investing in, okay? And again, guys, you can't go wrong with being certified with AHIMA or AAPC. You cannot go wrong. And do you need both AHIMA and AAPC? Certainly not, especially when you are brand new. Now, if you've been in a while and you want to change associations, or you want to maybe upgrade a little bit on your credentials, then that's a different story. But for the beginning part, when you see that they're offering in that program that you're in school for, the Cehrs, the CBCS, or the Nrccs, know that if you do your research and let your fingers do the walking in these job postings, you're going to see that these particular certificates are not being asked for. Okay, so just buyer beware. That's it. Buyer beware. And I just want you guys to get things that are going to be beneficial for you. that you don't have to buy everything that's put in front of you. I hear the horror stories all the time of people that are sold a bunch of these credentials. They don't even have a job yet, and they have 4 credentials, and they don't know how they're going to pay for their continuing education units because they have not yet been able to find a job. And instead of worrying about finding a job and focusing on it, where you can get credentials so that you can manage, right? Not so much, because the more credentials you have, and particularly with the different associations, is going to go up. The amount of credentials goes up, and you can find that information on the particular website where you are certified through. But if you're having to pay a lot of these out of pocket, you know, for these continuing education units, sometimes it's a benefit of employment. But if you're not employed yet, you know, you're going to have to come out of pocket for those. Now, there's a ton of places that you can go to online and find free ones. But that's something that you have to let your fingers do the walking on that one. Don't ask me, guys. Don't ask me where to find them. Okay, I can't. I don't. I don't give out that information, guys. You can do that. You can find it on your own, because medical coding is all about doing your research. It is all about, okay, well, if I can't find it here, let me try to think of another place to find it. All right. But yeah, my opinion, guys, just be careful about what certifications you're sitting for. I only recommend the 4. Okay, the CCS, CCA, CCSP, or the CPC. And one of these is all you need, especially when you're brand new. Get yourself some time in the field so that way you really understand. If your employer is paying for you to get additional credentials, that is fine. That's fine, because that's coming out of the employer's pocket. Let's minimize the amount of money that we're spending out of our own pocket as coders, right? Because again, the person with 1 credential can outrun somebody who has 6 or 7 credentials on their name. Really, really and truly. Because the excess amount of credentials means nothing if you cannot back that up with experience, or you cannot back that up with knowledge. Okay, so that's just what I want you guys to be careful about. And to close this out, if your program is offering this and you say, well, Blue, this is all I can afford right now, and it's included with the program, if you want to go that way, that's fine. But I would still recommend that you save the money to go through either association and get a certification that you know that you can sit for, because none of the 4 main medical coding certifications require you to go through a formal program. You can study independently if you feel like you need to augment what you learned in your program, because sometimes these, especially programs like these that are, you know, really fast and they're very cheap, sometimes they're only 4 months long, and they expect you to learn all this in 4 months, and heaven forbid, I see those ones that are 2 months long. And they say, oh yeah, you can be on your way to a brand new career. Give me a break, okay? Give me a break. 2 months, 4 months, ridiculous. As much as we have to know as medical coders, if you want to be taken seriously out there, and you want to be like, okay, you want to make all this good money, you think that good money comes to people that are just going to be sitting there in an office? No, it comes to people that have knowledge. They're paying you for knowledge. That is why the salaries are good the way they are. And don't ask me specifics on those salaries, because it's different everywhere, guys. It is different everywhere. But safe to say, the money is very good for medical coding, but you have to have the knowledge. There's a lot of people that complain that, oh, I couldn't find a job, I couldn't do this, I couldn't do that. Well, there's other ways of being able to get in. Sometimes you have to work your way in through different positions. I have a ton of videos about that. But as long as you arm yourself with a good credential, okay, one of the 4, a good credential, a good resume, a good attitude, and you're out there and you register with the temporary agencies for medical professionals in your area, you can Google, okay, guys, Google, okay, and say, you know, temporary agencies for medical professionals, and you will find all of those pop up. And they're going to be looking for medical billers. Sometimes they're looking for medical coders, and they're not sending you for one-day assignments either. Okay, they're sending you for assignments that are maybe sometimes a couple of months, sometimes they're a few weeks. You know, it really all depends, because they're not going to hire a coder for just one day. All right, but working with a temp agency will give you the opportunity to test out where you where you're working, not every place is for everybody. So this way, you know, if you don't like where you're working, you can tell the temp agency, hey, no hard feelings, and they'll set you up with another assignment. You know, so that's just an alternative to getting in. But there's a lot of people in this industry that will take advantage of new people, and I just hate to see that. That's why I come on here and I tell you guys, and sometimes it's not what you want to hear. I know that. Trust me, I get the comments, and it's not what you want to hear. But I would rather, as an adult, I would rather somebody tell me the truth and tell me what to expect, right? Rather than nobody told me, because we're all gatekeepers of this information and we don't want people to know. Why would I want to keep that from people? You know, there's a responsibility of veteran coders to the next generation of medical coders to guide them as much as they can. And so for some people, they say, well, I'm not helping them because nobody helped me. And yes, while that is true, I do think that we should help each other, but help each other in the way that would be beneficial to that person. It's like when I give my advice on where to go and where to find information and where to find resources, things like that, I would hope that people would listen to that. And so they can go and find it on their own. So basically, I'm helping you to fish, helping you to learn how to fish. You teach a man to fish, you feed him for the rest of his life, right? You give a man a fish, he's only going to eat for a day. But if you teach him, then he's going to be able to fish for the rest of his life. It's the same thing that I tried to do with all of you with medical coding. It's where I tell y'all where to find this information and what is the real deal about these things. I tell y'all that to set you up for success. So that's just me doing my part. All right. So I hope this has answered your question. You don't need these guys, the Cehrs, the Cbcs, or the Nrccs. What you do need is one of the four, the CCS, CCA, CCSP, or the CPC. That's just my advice anyway. So with that, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.